Hi, this is Andrea Kane, and I am back again to talk to you about the Language of Medicine, 12th edition, Davy Ellen Chabner, Medical Terminology for Class HSC 114. We are now on to Chapter 12, which is the respiratory system. If you look at your syllabus, this is Unit 8. So let's get into it. What are our goals? Same as always. We want to keep on going. We want to know everything there is to know as it concerns the respiratory system and medical terminology. So let's talk about respiration to start with. Respiration is the exchange of air in our lung capillaries. That happens when we have oxygen inhaled into the air sacs of our lungs. It passes into our capillaries. Carbon dioxide then passes from the capillaries into the air sacs and is exhaled. That's essentially external respiration. You breathe it in, you're taking in oxygen, it goes down through the air sacs of the lungs, gets into those tiny, tiny, tiny little capillaries. The capillaries say, yay, there's oxygen. And they take in the oxygen and they give back the CO2 to the air sacs. The air sacs exhale it back out saying, get out of here, we don't want you anymore. So you can sort of think of it as a warehouse where that happens. Internal respiration is what happens in the gases of the cell, is the exchange of gases in the cells. So external is what happens in your lungs, and internal is what happens between the cells and the capillaries. And it is occurring simultaneously. It is oxygen passes out of the bloodstream and into the tissues, and then the carbon dioxide comes out of the tissues back into the bloodstream through the veins, travels to the lungs. I'm sure we have a visual on that coming up, and that will make more sense, I think, rather than talking through it. Respiratory anatomy. You have some anatomy. You have a mediastinum. It's in the middle of the chest where the trachea divides into two branches. That's your mediastinum. You have bronchi, and each leads to a separate lung. You have lungs. There are lobes, and the lobes are not mirror images. You have what's called a hilum. That's your blood vessels, nerves, lymphatic tissue, and bronchial tubes that enter and exit. Notice lymphatic tissue and nerves and blood vessels. That's all part of respiratory. So we were just talking about the heart, and we'll be talking about blood vessels next week as well as lymphatic tissue. We've already talked about nerves. So just keep in mind how everything is so interrelated. So what does it look like in terms of respiration? Your external respiration, your internal respiration. How does that exchange take place? This is a visual to give you all those pieces and parts of what are involved, and then what that looks like on a tiny, tiny level. So to conduct air, you involve your nose, your nasal cavities, and paranasal sinuses, your pharynx, your larynx, and your trachea. When you're exchanging gases at the cellular level, you're talking about bronchioles, alveoli, and lung capillaries. So how does this all work? You breathe it in through your nose. It goes through your nasal cavities and paranasal sinuses into your pharynx. Remember those adenoids and tonsils? They do a little bit of filtering there. Then it goes to your larynx, your trachea, to your bronchi, through down to your bronchioles, the alveoli, into those little tiny lung capillaries where they exchange the oxygen that you took in your nose to the bloodstream, and they take back that nasty old CO2 or carbon dioxide, and they send it back up all the way to the nose and expel it. And that's when you breathe out. So let's talk about vocabulary. We have adenoids. That is lymphatic tissue in the nasopharynx. It's called pharyngeal tonsils. Note alveolus and alveoli, good old Latin, back again. Alveolus is singular, alveoli is plural. All right, bronchioles, those are the smallest branches of the bronchi. And again, bronchus and bronchi, good old Latin again. That US is singular, the I is plural. And we talked about carbon dioxide, CO2. Your diaphragm is a muscle that separates your chest and abdomen, and it contracts to pull air into the lungs, and then it relaxes to push that air out. If you hear a cat in the background, I apologize. It's my little Sousa cat, and she wants attention. It's like having another child. All right, epiglottis, that's that piece of cartilage that covers the larynx. Keeps food from entering that and the trachea during swallowing. And then the glottis is that slit-like opening to your larynx. All right, we have hilum, inspiration and larynx, lobe, mediastinum, and nares. Sousa, please, it's all right, you're fine. I know you just want to say hi. Are you coming up on my desk? Do you know that they're listening to all this? Can you settle down and be quiet? Oxygen, O2, and your palatine tonsil. It's one of a pair of almond-shaped masses of lymphatic tissue in your oral pharynx. Have you ever heard that you had a palatine tonsil? All the things you get to learn about medical terminology. Paranasal sinus, parietal pleura. Parietal pleura. Whoops. And pharynx. Sorry, cat stepped on my keyboard. All right, and pleura, pleural cavity, pulmonary parenchyma. Pulmonary parenchyma. All sorts of things here. Respiration, trachea, visceral pleura. So what is the tip or uppermost portion of the lung? Is it the base? Base usually means like foundation or bottom, so I don't think it's that. Nares we just studied, and I don't think that fits either. So I will leave you to figure it out. Combining forms. Remember our equation. It's a combining root plus a combining vowel, and that equals a combining form, and we have all sorts of those. And I'm going to fly through most of these. You can come back, slow down, or get them from your book for your flashcards. We have some suffixes. Do not confuse ptysis with ptosis. P-T-Y-S-I-S is spitting. P-T-O-S-I-S is that drooping. So what are some diagnostic terms related to the respiratory system that you might run across? There is something called auscultation, percussion, which is not drumming, so to speak. Plural rub, rails. Occasionally I've heard of somebody say rals, but rails is usually what I've heard. Crackles, rhonchi, or the singular bronchus. Again, back to your Latin, the US is singular, the I is plural. Sputum, stridor, and wheezes or wheezing. Upper respiratory disorders. What are some things you can get in your upper respiratory system? You can get something called croup, something called diphtheria. Watch out the spelling on that. That PHTH is a killer, isn't it? Really have to work on some of those words. Epitaxis, epistaxis, epitaxis. I usually do epitaxis, but you've got to remember that S is in there. And then pertussis. Have you ever heard about getting vaccinated for pertussis, diphtheria, and something else? The DPT, tetanus. So it's diphtheria, pertussis, and tetanus. You may have gotten that combination of vaccinations growing up. A DPT shot, that's what that's for. Oops, I went backwards again. Bronchial tube disorders. Asthma. Asthma is a very common bronchial tube disorder. And it can have a hereditary component in it. It can have an allergic reaction component in it. There's all sorts of reasons why somebody might have an asthma attack. Bronchiectasis, chronic bronchitis, and cystic fibrosis. Again, all those are types of diseases that attack the bronchial tubes. Lung disorders, atelectasis, Emphysema. You may have heard of someone who has emphysema. Lung cancer. Pneumoconiosis. Pneumoconiosis. Pneumonia, pulmonary abscess, pulmonary edema, pulmonary embolism is the singular. Pulmonary emboli is the plural. Pulmonary fibrosis, sarcoidosis, tuberculosis. You may have heard of tuberculosis as well. So, lung disorders, atelectasis. Atelectasis is sometimes known as collapsed lung. If you hear of somebody with atelectasis, something's gone wrong with their lung and it's not filled with air. It's not up and moving as it should be. It has fallen or it's got some kind of fluid or air accumulation in it. So you might want to see about that. Pleural disorders, there's mesothelioma. You may have seen some medical malpractice and not really medical malpractice, but more legal malpractice attorneys who want to get a settlement for someone who has mesothelioma, that maybe they were exposed to something like asbestos that that unfortunately has damaged their lungs. That's the other cat. So you've heard 2 out of 3 today. Sorry about that. I have the kids out of the house and the husband out of the house, so it's relatively quiet here, but I guess that means you can hear the cats. And that's Keta. All right, Keta, you can say hi and then you got to settle down. All right, pleural effusion, pleurisy, pneumothorax. Pneumothorax is when you've got air in that pleural cavity where it's not supposed to be. You want air in your lungs. You don't want it in your pleural cavity, and that's when you get pneumothorax. So, what are some other things you might run into? Anthracosis. Anthracosis. That has to do with coal dust. People who have been coal miners that haven't had appropriate safety precautions may develop that condition in their lungs. There's asbestosis. Again, somebody exposed for a long time to asbestos may end up with that. You can have bacilli. Instead of bacteria, bacilli, that's plural, multiple types of bacteria. Chronic obstructive pulmonary disease, COPD, that is a very common one. I would say that a lot of the elderly who are seen in physician offices have COPD or CHF. It's just, again, where your lungs are not functioning the way that they should. And there's a wide variety of things that can cause COPD. It can be from smoking, long-term smoking. It can just be from wear and tear on your lungs. Over time, it can be that maybe you've got some other things going on, but that's another common one you want to be aware of. Cor pulmonale, it's more rare, but it happens when it involves the heart, as you can tell. Cor pulmonale. Exudate, hydrothorax, infiltrate, palliative, paroxysmal, pulmonary infarction. Yes, you can have a myocardial infarction, but you can also have a pulmonary infarction. They're much more rare than a myocardial infarction, but you can still have those. Purulent and silicosis. So what are some procedures that are done on the respiratory system? Obviously, chest x-ray is the most common. That is sort of like a base exam that if somebody's having problems with their chest or shortness of breath or what have you, they're going to immediately go to a chest x-ray. There's a CT of the chest that can be done. Pulmonary angiography. When I talked about this, I think in the last one, that I had pulmonary emboli at one point, and they did a pulmonary angiography on me to find all those blood clots in my lungs. So we already know about x-rays, that they're imaging, radiographic imaging, and this is a normal one. It lets you see what they're looking at. This is an MRI, and this is like a cross-cut looking at it. If you look down here, you can see the spine. Okay, that kind of orients you as to what's going on. Nuclear tests, those nucleides, nuclear medicine, PET scans are done. Ventilation perfusion scans, VQ scans, those are done as needed, and that's where you inhale radioactive gas and then they image you. Then they follow it by injecting different radioactive materials and then do another imaging. So it's a VQ scan. They're looking for that perfusion between air and how that's crossing over into the bloodstream. Bronchoscopy, that is where they're putting an endoscope down your throat into your lungs, and they may be taking a brushing to get some cells out to see what's going on with that, or they may just be looking around. Endotracheal intubation. If someone is having a difficult time breathing, they will do what's called intubation. They will put a tube through the mouth, down the trachea to establish an airway. They use what's called a laryngoscope, and they put it down there, and they make sure the tube is placed, appropriately placed. A lot of endotracheal intubation takes place. The two most common places it happens are in the emergency department and in surgery. Also, intensive care occasionally, but usually by the time somebody gets to intensive care, they've been through the ED or they've been through surgery, and so they've already been intubated. But if somebody is on a hospital ward unit that is not intensive care, and let's say they deteriorate and they need to intubate them, they bring them to the ICU, the intensive care unit, and they'll intubate them there. So what are some clinical procedures? They use that laryngoscope to take a look, laryngoscopy, lung biopsy, mediastinoscopy. Pulmonary function tests are very common. You'll see a lot of those done. Thoracentesis, that's putting a needle down into the lungs and removing some fluid, or into the pleural cavity and removing fluid. Thoracotomy is that cutting into. Thoracoscopy is that viewing into. Tracheostomy, that's a cutting a hole into the trachea to facilitate breathing. If for some reason maybe somebody's choking and they can't get past whatever it is in their throat that's choking them, they may do a tracheostomy to open up and get the breathing going while they deal with trying to get whatever the obstruction is out of the throat. Tuberculin test to find out if somebody has tuberculosis, and a tube thoracostomy. A thoracostomy is where they go in through they make an incision through the rib area. So thoracentesis, I talked about this a little bit earlier. They put in a needle and they remove fluid from that pleural space. Not fun. They can take off liters of fluid, and in a really bad case, maybe up to a gallon. How someone survives with that much fluid in their lungs is a miracle. Tracheostomy, we talked a little bit about that, where you cut into the trachea and put in the tube so that someone can breathe, especially if there's some kind of obstruction there that keeps the person from breathing. Abbreviations, lots and lots of respiratory system abbreviations here for you. And still more. And still more. And still more. And now we get to our combining forms. It's a combining root plus a combining vowel equals our combining form. Notice that there's 2 for bronchial tube. Most of these you've already had. Notice that there's 2 for lung air gas. And notice there's 3 for lung right there. Some suffixes for you. And that is it for the respiratory system. I know we flew through that. I didn't cover a whole lot of the pathology with that one. But hopefully, if you've got any questions or concerns, you can take a look at your book, or you can do a Google search and take a look and see what you think of all that stuff. Hope you're doing well. Hope you're having a great week. If you need me, reach out. And again, these 2 chapters, chapters 11 and 12, cardiology and respiratory, are for week 5. And enjoy, and I'll be back again with videos for week 6, and we will talk about the blood system, the lymphatic and immune system, and the endocrine system. Take care.